Hello, I'm Dr. Ruth Schmidt-Neven, clinical psychologist and child and adolescent psychotherapist based in Melbourne, Australia. Today, I'd like to talk to you about working with parents when we work with children and adolescents. This refers to the combined child-parent model of assessment and therapeutic communication I have developed over several years in practice. This model of working is based on evidence that the most enduring therapeutic outcomes involve a shift or change in the parent's relational understanding of themselves, as well as a change in the child or adolescent. I will commence with some underlying or basic assumptions about therapeutic work with children and adolescents that arise from my clinical experience over 5 decades, as well as from my earlier training in child psychotherapy. In doing so, I'll be knocking over a few sacred cows and challenging long-held beliefs about child and adolescent therapy that I believe are no longer fit for purpose. I start from the position that the complexity of problems presented by children and adolescents will rarely be responsive to a solely individually focused approach. The problems presented by children and adolescents instead need to be interpreted more broadly to consider the essential links between the several domains of the intrapsychic, the interpersonal, and the social and systemic. And these must be reflected on in our therapeutic work, and they must be reflected in the therapeutic work. This leads us away from a limited problem-centered focus to a focus that is person in relationship-centered. I'm reminded in this connection of Winnicott's famous dictum that there's no such thing as a baby, since the baby's development can only take place in the context of individual and social embeddedness with the parents, the family, and significant others. The same can be said of children and adolescents in that there's no such thing as a child or adolescent outside of their dependence on and essential connectedness to their relational world of parents and family supports. Decades on from my child and psychotherapy training, while I learned a great deal from this training, I also learned as my own practice progressed that an exclusive focus on long-term therapy for the individual child with their parents seen only once a term for general feedback could simply not be countenanced as a generalizable model of therapeutic work. On reflection, it appears to represent a kind of therapeutic boarding school for children who have an intensive relationship with their therapist and then are somehow connected to their parents once a term. This does not mean that I reject the underlying psychoanalytic or psychodynamic framework of therapeutic work. On the contrary, my conviction about this model and its usefulness and application have only increased over the years.